On this program, I've chosen to really focus a lot on this measles outbreak, something completely avoidable. But things have gotten so bad that Rockland County in New York's Hudson Valley has actually declared a state of emergency, which means unvaccinated minors, they're banned from public places. Rockland alone has more than 150 cases reported. Many of the recent outbreaks, they're centered in the ultra-Orthodox communities where people claim a religious exemption to avoid giving their kids the shots. Well, the Centers for Disease Control say that we have seen more cases so far just this year, and we're only in the beginning of April, than we had in all of 2018. Now, this is especially frustrating because this is, as I said, preventable, and the disease was once thought eradicated. Well, joining me now to explain, Dr. Kristin Oliver. She's a pediatrician at Mount Sinai Hospital in New York. 15 states have been reporting this. We're also reporting in our news incidents of scarlet fever. I mean, smallpox. I mean, this is crazy. I mean, we're talking about diseases we thought we had eliminated in some cases in the early part of the 20th century. In the medical community, I'm curious, you guys almost having to go back to the research books to say, how do we deal with things that we thought we had already figured out with science a generation and a half ago?
Well, we know how to prevent them. We prevent them with immunizations, right? So I think that part is solid. And pediatricians are basically 100% on board with the importance of immunizing all children and appropriately adults for adult preventable diseases as well. I think what we have to go back to the drawing board to a new drawing board is how do we do a better job communicating, A, that these diseases are serious and can be deadly, B, that these vaccines are safe, and C, that these vaccines are very effective. And that's what we need to focus on.
I do understand that, and certainly the internet can be a great tool, but it can also be a dangerous one in terms of spreading theory as fact. But it's not just in the deep recesses online. The governor of Kentucky, this guy, Matt Bevin, he's openly questioning about the significance or the necessity of vaccines. You're running up against people with big platforms here who are saying everyone in the medical community is either there's some conspiracy, they're looking out for the almighty buck, or they're trying to protect big pharma, whatever else. It's not just the trolls doing this. You have people with microphones that people listen to that are spreading this garbage.
There's a lot of misinformation out there, and I think it's easier and easier today to end up with that misinformation in your inbox or on your news feed or on your Facebook channel, right? And so I think the importance is to remind people that who do you really go to help you make decisions about the health of your children and your family. You go to your pediatrician, right? Pediatricians, our lives are dedicated to keeping kids healthy, to keeping kids safe. And so when you have a question, a medical question about how do you keep your child safe and healthy, you need to go back to your pediatrician and to your family doctor and say, what should I do about this? And that's where people need to take all their questions to, with whatever information that's coming into them.
But you guys are only as good as the enforcement mechanism. Yes, the education, crucially important to try and combat the misinformation, but different states to this point had tried, certain ones at least, policies where they made it more of an elective for vaccination. I'm seeing now states going in a certain trend to make it mandatory with no exceptions. That's really the only way to do this. You can't do, multiple choice here as to whether or not you choose to, whether you choose to report it, and making it basically an elective for the parent. It has to be a yes or no.
Right, so states decide how they're going to make the mandates, and they're school mandates. So it's not that you have to get your child vaccinated, but your child has to be vaccinated if they're going to attend school. And there's different types of exemptions. You can have religious exemptions, medical exemptions, and philosophical exemptions. Everyone agrees with medical exemptions, right? There's certain people who should not be vaccinated if they have an allergy to a vaccine component or a medical condition that makes it unsuitable for them. The other exemptions, we know that in states that only have medical exemptions, they have fewer kids who are unimmunized, right? So states who have both religious and philosophical exemptions, not surprisingly, there is an increase in people who take that exemption, and then you can see lower vaccination rates, usually in specific communities as well.
When you hear of this, new trend or a reemergence of one, these pox parties that parents are throwing as a way to introduce their kids to chickenpox and then as consequentially be able to skip vaccinations altogether. What would you tell those parents?
Again, that we, unfortunately, since we don't see these diseases so often anymore, really underestimate how dangerous they can be. And I think it's specifically even more so with measles than with chickenpox. Certainly, measles is much more serious. Kids get incredibly sick. They can get some serious complications, right? They're getting ear infections. They can get pneumonia. They can get encephalitis, which is a swelling of the brain, and they can die. So you are much better off getting the vaccine and having your kid protected that way and not be getting these potentially really serious adverse events if you're going to have these types of exposures that are otherwise avoidable. I would 100% do not recommend that people do that.
Doctor, I'm sure even outside of the office, you've had the similar conversations or debates that I've had, where you'll be sitting with what you would believe to be a rational set of parents, and then the subject of vaccinations comes up. Inevitably, someone will reference something that they read online. And then I can mention every alphabet soup, from the AMA to CDC to the Pediatric Association, and it's almost like white noise. In retrospect, do you think the medical community made a mistake by saying, well, listen, every reputable group says vaccinations are safe, and just took it as faith that that would be absorbed by the general population? Do you think that if you could go back 10, 15 years ago, there'd be a greater educational campaign to rebut some of these conspiracy theories that are floating out there?
I think it's not too late to do that. I think we clearly need to do a better job with our messaging and explaining in a little bit more detail why and how we know these things are safe. And the things that people are concerned about are often a coincidence and not actually related to the vaccine. I mean, we live in a country that has an incredible system for checking the safety of vaccines, obviously before they come to market and then afterwards, and up to millions of people. I think we need to do a better job explaining to parents that system is in place and that we've really looked into these concerns. And the other thing is to sort of remember that the vast majority of people just have questions. Parents that may have questions or concerns. We all want the same thing. The parents want to keep their kids safe. We want to keep their kids safe. We just need to make sure that people are making decisions with the correct information so they can keep their kids safe. Address those questions respectfully. Understand they're coming from a place where they really want to keep their children safe. Make sure you're addressing their questions with scientific answers and help people come to the right decision to vaccinate their kids to keep them safe.
A good point, not to demonize if someone has bringing a concern to the table. Finally, and I know the pediatric community is not limited, nor are your conversations to just the contiguous 48 states, but this is going on in other countries, including European countries as well, these same conversations. How concerned are you and fellow doctors here that if you don't turn this around, what is a problem right now could be a full-blown real crisis if we're not careful? Because, as I said before, this is not just a conversation we're having in the States. I know in Italy and a bunch of European countries now they're struggling with policies about making it mandatory or making it, a request, in effect, to parents to vaccinate their kids. And obviously, we're a global world here where people cross borders. How concerned are you that we have a limited amount of time to really get our arms around this?
I think there's definitely concern. I mean, most of these cases, when we talk about measles, for instance, they're all importations from other countries, right? You're exactly right. European countries have lower immunization rates for a lot of these vaccines than we do, which is why they see more cases of it, and it's more likely to come into us and start outbreaks here. And the more that we see specific pockets of areas that are under-immunized and have lower immunization rates, the more likely we are to see these outbreaks. And I think likely we will be seeing more numbers of outbreaks before we get our message out there, really turn people's minds around, and get them to understand these diseases can be serious, they can be deadly, and the vaccines are safe and effective. I think we can turn that around. I'm very optimistic about that. I think at the end of the day, people are going to eventually listen to their pediatricians, and we'll do a better job of getting that message out there. But it is a concern that things could get worse before it gets better.
In addition, doctor, if people at home have questions, to go to their pediatrician directly with it, where else can they go for good information that might answer a lot of their questions?
I think the best sources of information are certainly the CDC, the Centers for Disease Control. They put a lot of great information out for this. And I'd also recommend the American Academy of Pediatrics. Healthychildren.org is one of their websites, and the American Academy of Pediatrics really puts out great information both for parents and for pediatricians and professionals. Specifically, if you're worried about something going on in your community, then your local health department is a great resource.
Dr. Kristin Oliver, thank you so much. I really appreciate the time.
My pleasure.
All right, everyone, when we come back, we're going to switch some gears and, yes, talk a little baseball. The Mets, well, they had their home opener today hosting the Nationals. We're going to show you just how things went and also provide some updates on the rest of the teams in our area. We'll head out live to Citi Field after this.